Welcome to the Real Estate Espresso Podcast, your morning shot of what's new in the world of real estate investing. I'm your host, Victor Menashe. On today's show, we're taking a look at what might be a looming crisis in healthcare. For years, many states have been facing an acute nursing shortage, and it's only expected to grow. Bureau of Labor and Statistics predicted that the United States will need another 203,700 new registered nurses every year until 2026 to fill openings that are coming up. And while the general population is aging, so are some nurses in the workforce. According to the Florida Center for Nursing, more than 40% of nurses are within the baby boomer demographic and are looking to retire in the next 10 years. There's a constant need to find new and younger nurses to replace them. According to a new study, fully one-third of nurses plan to quit their jobs by the end of 2022. There's a lot of reasons for this. Later this week, we'll actually speak with one of those nurses who forms part of the army of people who have heroically put themselves in harm's way during the pandemic. The working conditions and staff shortage have taken their toll at the individual level. Burnout from working through the pandemic continues to be driving nurses to quit their jobs. Nurses cited burnout and high-stress work environments as the number one reason for leaving their jobs, followed by pay and benefits. Among those leaving or planning to leave, higher salaries are the top motivating factor for taking other positions. Nurses are also leaving for other jobs with greater flexibility and opportunities for career advancement. That's according to the survey. Hospitals are battling some of the worst staffing shortages they've faced since the pandemic began, as burned-out healthcare workers continue leaving their roles. Many are quitting to take higher-paying traveling nursing positions or opting for early retirement, as our healthcare systems attempt to wrangle with heightened labor expenses. In places where the need is particularly acute, traveling nurses are working on short-term contracts for up to $5,000 a week. They find temporary accommodations in Airbnbs and VRBOs, and sometimes you can find several traveling nurses sharing the same temporary accommodations. Even with the added travel costs, these nurses are often doubling their wage. Some of the healthcare sources I spoke with have told me that COVID-19 funding has been a key factor in enabling hospitals to hire traveling nurses. But as this funding comes to an end, the tools available to hospital administrators to hire during acute staff shortages are becoming more limited. The shortages are most acute in cities with high housing costs. Burnout is a key factor, followed by pay, though in general salaries on average haven't risen substantially. That's according to a survey that was based on data collected from 2,500 nurses in February. Instead of boosting salaries to recruit and train staff, systems have opted for sign-on bonuses. The number of offers, including such bonuses, rose 162% in the past year. In Texas, 58% of offers include signing bonuses in 2021. That's compared with 16% in 2020. And bonuses nearly doubled in value from $5,800 to almost $11,000. But salaries in the state overall decreased 5% over the year, at least according to the report. Meanwhile, California has the highest nursing salaries, which are about 20% above the national average. Signing bonuses have been effective in enticing nurses to relocate for new positions. As the healthcare workforce continues undergoing some major transitions, 2 years into the pandemic, issues with traveling nursing staff continues to be a key pain point. They're commanding much higher rates than permanent staff, spurring some to leave those roles elsewhere and causing more problems for those who stay. Among the nurses surveyed, 77% said they'd seen an increase in traveling nurses in their unit over the past year, and 33% said that's caused an increase in dissatisfaction among the permanent staff. Differences in compensation was the leading cause of dissatisfaction, and the culture of a unit changes when you've got an influx of temporary staff. At the same time, nurses said patient frustration, racism, discrimination, and assaults are all on the rise, partially due to the ongoing COVID-19 guidelines, and some 65% of nurses said that they'd been actually verbally or physically attacked by a patient or a patient's family member in the past year. 52% attributed the problems to the pandemic restrictions, and 47% said it was a result of longer wait times and other issues caused by lack of staffing. These staffing shortages are so troublesome, they've left patient safety as a top concern this year. That's according to another report from the Emergency Care Research Institute. That study found that shortages are actively jeopardizing patient safety, with many patients waiting longer for care, even some in life-threatening emergencies. Some Florida hospitals are offering tuition reimbursement for employees who want to go to nursing school. That is, if they hold another position in the hospital. That's to encourage students who may want to become a nurse but are worried about paying for school to pursue their schooling. As entrepreneurs, our job is to understand huge business problems and to conceive of solutions to those problems. In many communities, the lack of affordable housing for nurses is a major factor in staffing those positions. And this is an area where we as real estate investors and real estate developers can play an active role. As you think about that, have an awesome rest of your day. Go make some great things happen. We'll talk to you again tomorrow.